The 2017 ACG guidelines identify some additional areas where testing for H. pylori is important. One of these areas is before a patient starts long-term treatment with aspirin or other non-steroidal anti-inflammatory drugs. And the reason for that is that aspirin and non-steroidal anti-inflammatory drugs are an independent risk factor for peptic ulcer disease. H. pylori is an independent risk factor as well. So when these two risk factors are combined, the probability of getting peptic ulcer disease increases markedly. The patient needs to be on the NSAIDs or the aspirin, but the H. pylori is a risk factor that we can take out of the equation. So before starting a patient on aspirin for cardiovascular disease prevention, for instance, or other non-steroidal anti-inflammatory drugs in patients who might have arthritis, it's important to get rid of an additional risk factor for peptic ulcer disease that they might have. So it's important for us as clinicians to think of H. pylori and to look for it in patients who are about to embark on treatment with aspirin or other NSAIDs for a long term. The other area that the guidelines had mentioned was in patients who have iron deficiency anemia. Patients who have iron deficiency anemia and the other obvious causes have been ruled out. H. pylori may be a cause of iron deficiency anemia in those individuals. So testing for H. pylori is one of the steps that should be included in our protocol for evaluating iron deficiency anemia.